The hair transplant industry has evolved so much since it started here in the United States. What's happened is we've gone from one extreme to another extreme. In the past, they were doing punch biopsy grafts. They would take an instrument that looked like, a pencil. They would punch a hole out of the back of your head in the safe zone. Then they would take that same punch biopsy instrument, punch a hole on the top of your head. They would take that 15 to 25 hair graft and they would plug it in. That's where we got the term plugs from. The problem with these plugs is they were so big and unsightly, they would have to separate them in order to secure that they would live. The closer they were, they would fight for the blood supply, and then they wouldn't grow. So they'd have to space them, and that's how they got that term doll's hair, because the old dolls used to be spaced out that way. Well, that's how they used to be done. Well, the industry went from those big punch biopsy grafts now to where we harvest one little hair at a time, and that's called a micrograft. And that's what's put in the frontal hairline. The micrograft is used now by every hair transplant doctor. The other thing that's being used is what's called a follicular unit. A follicular unit is a naturally occurring bundle of hairs that we all have. The average follicular unit might have anywhere between 2 to 4 hairs in it. The hair transplant industry average will use the equation 2.5 hairs per follicular unit for your hair count. So now what mostly every hair transplant doctor will do is what's called a follicular unit hair transplant. The disadvantage of using micrografts, one hair grafts, and follicular units solely is you cannot achieve density. How much density are you going to get if I put a 1 hair or 2 hair graft in the center of your head? You'll have very limited density with that. When I do a hair transplant, I 100% use 1 hair grafts in that frontal hairline to make sure that the hairline looks super soft and super natural. Once I get behind that hairline, I'll use the follicular units, that naturally occurring bundle of hair. What I do differently than everybody else is I use a graft that's called a multiple follicular unit graft. This should not be confused with plugs because it is not a plug. This is a slit graft. It's just slightly bigger than the follicular unit. What this does is this allows me to achieve more density for my patients. The more a graft is cut, the more of a chance that you're going to transect the follicles and cause damage to that follicle. So by keeping that bundle intact, I'm able to achieve more density for my patients. This is back behind the hairline, so it's completely undetectable, completely natural looking because it's blended in with other little tiny follicular units all the way around it. So you cannot tell the difference, and it looks super soft and super natural. Allows me to achieve more density for my patients. Allows my patients to get out of the procedure sooner because they don't have to break it up as much. And it allows the patients to have less procedures because I'm able to move more hair for them.